Good afternoon, DM.
Good afternoon, Dr. Nyat. How are you?
I'm all right, and how are you?
I'm okay.
All right. Now we're just about to go in.
No problem.
Good afternoon, Dr. Alwalia. Good afternoon, Dr. Ramnik.
Good afternoon, Dr. Fundi. It's such an honor. Just
thank you.
to ensure that.
Yeah. All right, we're just gonna go in the next few minutes. All right, Dr. Mahlangu.
Can everyone hear me?
Yes, I can hear you. You can sit up a little bit, raise your chair a little bit, so that we can see that that grooming.
I think this is the highest my chair can go.
Okay. DG, the light behind you is affecting the quality of the picture. If you can just get the light.
You want to see me for who I am?
Yes, especially because you're wearing a Maxxosa mask.
Let me fix up my office a little bit, sir.
Yeah. You're wearing a mask that went to private school.
Of course.
Thank you.
I think I must just sit in my desk. How is it here?
It's fine. Just settle. We have to go in now.
Okay, I just need to bring my laptop.
We are live, DG, so yeah, you can unmute yourself. You can mute yourself for now.
Okay.
All right. I think we are going to go in. Good afternoon, ladies and gentlemen, dames and yere, bomme, libondate, manene nani manenekazi. My name is Fundile Nyati, a qualified specialist family physician with a special interest in the field of psychiatry, also a CEO of Proactive Health Solutions, which is a employee health and wellness company. That's one of the accredited health risk managers by DPSA. I will be your program director for the duration of this webinar. My task is a relatively easy one, to just direct the proceedings in a professional and efficient manner to ensure that the purpose of the conversations or discussions are met or is met. And the purpose of the webinar is really to increase the awareness about issues of mental health amongst the public servants before and during this COVID-19 period, as well as to demonstrate that the public service, as the largest employer in the land, does care for the mental health and well-being of all its employees. The theme of the webinar is mental health for everyone, everywhere, now and beyond COVID-19. And the tagline is, "You are not alone." Now, just a little bit of context without wasting time about mental health. Pre-COVID-19, some sectors of the public service, as a result of the nature of the work that they do, they're more affected by issues of work-related stress. And that includes the justice and security cluster, that includes the education sector, and also social development sector. However, during COVID-19, to the list above, one can also include the healthcare sector, where their frontline, healthcare professionals come face to face with this pandemic. So today, our eminent guests who are appropriately qualified and relevant in terms of work experience, they will share their professional insights on the topic of the day. Before I call on the DG to welcome us, I will ask Mr. Moses Mushi of the DPSA to advise us on the webinar ground rules that we will need to observe for the duration of the webinar. Mr. Moses Mushi, over to you.
Okay, thanks, Dr. Nyati. I've actually put them up there if they are visible.
Yes.
I'll put them up on the screen that we are saying, please adhere to the house rules to keep your account on the platform. That basically means that all of us will be on the platform if we follow the ground rules. And Dr. Nyati will be calling out, those who do not follow the ground rules so that we can have order on the platform. To ensure the smooth course of our program, speakers and moderators are requested to turn on their videos and microphones. Audience are requested to keep their microphones on mute to allow participants to focus on the presentations. You may type in your questions in the chat box, and please do not spam the chat box, meaning don't post things that are not relevant to the discussion. And one more important rule is that we request questions to be limited only to the topic of the day. So we have planned for the webinar, and then we have planned according to time, so we will not have time to venture into other topics that are not related to the topic of the day. Thanks, Dr. Nyati.
Thank you. All right. Thank you, Mr. Mushi. Now, I am going to hand over to the Director General of DPSA, Ms. Yoli Swamakasi. Where I come from, we always give, or introduce people with their clan names. I'm not sure at the workplace that happens or not, but her clan name is Madosini. So over to you, Madosini. You can welcome us.
Thank you very much, Dr. Nyati, and good afternoon to everybody who is tuned in different platforms. My job is very brief, is to welcome you. And I want to first acknowledge the presence of the Deputy Minister, who has kindly agreed, Deputy Minister for the Department of Public Service and Department of Public Service and Administration, Mama Usindisiwe Chikungo, for agreeing to be part of this webinar today. And I do want to acknowledge the experts that are here. I see we have a number of experts from different platforms who are here, and we look forward in you sharing your ideas and your views with some of the people in the public service and generally everybody who's watching and who's interacting with the program. I do want to also just to acknowledge some of my colleagues from the public servant, be they senior managers or at different levels in the public service, because we have shared the invitation widely and we have asked them to join in. Our esteemed guests who are joining us on online platforms. And I do want to acknowledge the facilitator, Dr. Nyati, for your kindness and your support. We appreciate that you were available to do this for us, and you were willing to partner with the department. We appreciate that. I want to just say that it is said that human capital is the biggest asset of any organization, whether privately owned or public institution. And I couldn't agree more with this. The well-being of people employed to carry a particular task is as critical as the end product they have to produce. It is therefore an immense honor for me that we are gathered on this online platform to discuss COVID-19 pandemic and its impact on mental health, amongst others, as well as the need for improved care and support programs to public servants in South Africa. This year's Mental Health Month is commemorated under the theme, Mental Health for Everyone, Everywhere, Now and Beyond COVID. The need for discussion on this topic could not be more relevant considering that the state employs more than 1.2 million public servants. By any measure, this is a very large number of employees, and as such, detecting and managing invisible illnesses associated with mental health can fall through the cracks. As a public service, we have a responsibility to provide emotional care and support to our employees through our employee health and wellness programs, as the mental well-being is as important managing any other disease in the in the workplace, particularly in the public service. In order to address the need for a healthy work environment, reduce anxiety and uncertainty amongst employees, the Employee Health and Wellness Program in government departments is designed to address these challenges in the workplace. The Employee Health and Wellness Strategic Framework for Public Service caters for the provision of psychological support in the public service. It is more during this time when we are learning to cope and living with the coronavirus, not only in the workplace, but in society at large. I am sure my learned colleagues who are part of the panel from the medical professions and other professions they come from will concur with me that the nationwide lockdown did have a lot of psychological effect on many people. Since our encounter with coronavirus as the public service, we had to come up with innovative ways to ensure that service delivery to citizens in the country continue without much interruption. More so, the devastating economic effects that the virus had on our society increased the need for more people to rely on government services to survive. As such, the demand is on public servants to face the pandemic head on and deliver the necessary government services such as health, law enforcement, education, amongst others, and generally the business continuity throughout the public service in all government departments. What we need not neglect during this period of the pandemic and beyond is the need to assess the mental well-being of public servants continuously, especially those in health profession who on daily basis have to take care of those infected by viruses. It could be that the whole phase of the pandemic is affecting them mentally, and we have an obligation as a public service to also look after them as they look after our citizens. In conclusion, Chair, I just want to say from the engagements of today, hopefully we will emerge more empowered on how the public service can improve its care and support on public servants, more so during and post-corona pandemic. I am also looking forward to the inputs because we are, as the department, involved in a process of review of some of our policies as part of our annual performance plan for the current financial year. And the input that's coming here from experts and from those who will participate in the conversation will make a greater input in terms of how we improve and how we ensure that we provide policy frameworks and policies in the public service that are responsive to the needs of the people that we are serving and the people that we are supporting in the public service. We should be a public service that is on a daily basis driven by Batupile value statement: we belong, we care, and we serve. So I welcome all of you to this webinar and wish you a fruitful deliberations on this critical topic, which affects not only the core machinery of government, but everyone in society. And as the tagline for this conversation says, you are not alone. We must fight the pandemic together, but we must also attend to our mental health and wellness as individuals and in the workplace and as well as society. Thank you very much, facilitator.
Thank you very much, DG. I was happy to hear that this will not just be a talk shop, but valuable inputs will actually contribute in the review of policies so that you can take better care of your most important assets, which is the employees. So with that, I am going to introduce our Honorable DM or Deputy Minister, Sindisiwe Chagumba. Over to you, DM.
Thank you very much, Program Director, Dr. Fundile Nyati, the DG of the Department of Public Service and Administration, Ms. Yoliswa Makasi, our esteemed guests and participants, senior managers from the public service employees across the 3 spheres of government, our esteemed guests who are joining us in online platforms, members of the media, ladies and gentlemen. It is indeed a privilege to be part of this important discussion on the impact of the COVID-19 on the mental health of our public servants and how the public service can provide care and support programs to the affected servants. Program Director, I should from the onset acknowledge that we are holding this webinar during the significant month of July, which is commemorated by the South African Federation for Mental Health as the Mental Health Month, which also coincides with the birthday of Madiba. In this very month, we have seen nations of the world rolling up their sleeves to make a difference as we celebrated the International Mandela Day. Our former President Mandela cared for everyone, irrespective of their background and status. It is important that as we discuss the topic of this webinar, we take heed of Madiba's decorum in treating each other, especially those among us suffering from various mental conditions. Program Director, I must express our sincere condolences to the families of all those who have lost their loved ones who served in the public service. We also wish those who are infected a speedy recovery, particularly our public servants. Ladies and gentlemen, the World Health Organization defines mental health as a state of well-being in which the individual realizes his or her abilities. The World Health Organization defines mental health as a state of well-being in which a state of well-being in which the individual realizes his or her own abilities, can cope with the normal stresses of life, can work productively and fruitfully, and is able to make a contribution to his or her community. Here at home, the Mental Health Act 17 of 2002 defines mental health status to mean a level of mental well-being of an individual as affected by physical, social, and psychological factors, and which may result in a psychiatric diagnosis. The same act defines mental illness as a positive diagnosis of a mental health-related illness in terms of a diagnostic criteria made by a mental health practitioner authorized to make such diagnosis. According to the World Health Organization, the average person spends at least a third of their adult life in the workplace. It is thus important that the workplace is a conducive environment that employees can function at their peak, working productively and fruitfully. A workplace is important because it can either contribute positively to a person's mental health or exacerbate an existing problem, or may even contribute to the development of a mental health problem. It is thus important that employers, as part of their employee health, wellness, and wellness agenda, should put in place programs to promote the mental health and wellness of workers, and must have mechanisms to ensure that mental health problems are prevented or detected early, diagnosed, and effectively treated. What should always be emphasized is that mental illness is an illness like any other physical illness and can be prevented. When you happen to have a case of mental illness, it can actually be treated, but it can also be controlled in case where it cannot be cured. The public service is the biggest employer in South Africa, as the DG has indicated. The public servants come from a society with its own challenges. Currently, COVID-19 has exposed our vulnerability as employers and employees. It has tested our physical and mental health. Those who had pre-existing conditions of mental health may find themselves predisposed to severe levels of mental health conditions during the COVID-19. The public service has taken strain during this time, as a number of public servants are as affected as all citizens. As of 27 July 2020, there are 187,722 GEMS beneficiaries in the public service who have tested. Of this number, there are 43,209 positive cases and 699 fatalities. The percentage of men public servants affected by COVID-19 is at 32.5%, while women public servants are sitting at 67.5%. Ladies and gentlemen, the above statistics call for effective preventative measures of medical disorders, including but not limited to health education, screening, counseling, stress management, managing change, and other wellness promotion strategies. These preventative strategies are amongst the purposes why employee health and wellness units were established and institutionalized in the public service. As we currently find ourselves in an abnormal COVID-19 pandemic reality, employee health wellness is responsible to educate and bring awareness to the public service employee on COVID-19 pandemic. We need to answer the question on how to prevent this, how to detect it, as well as measures to treat symptoms and how to destigmatize COVID-19. Some of the required interventions are being implemented, and we do need to measure their impact. Our public servants come into contact with people who are potential carriers of the virus. These experiences expose them to mental conditions such as fear, anxiety, and even depression. The mental impact of the above experiences translate into many mental illnesses if not prevented, if not detected early or diagnosed and treated. These have a direct impact on workplace through increased absenteeism, reduced productivity, and increased cost. What is of apprehension is that because of stigma and discrimination attached to mental illness, very few South Africans, including public servants, seek treatment for their mental conditions. This means we need conscious employee health and wellness officials who are able from time to time to measure the health and wellness of the employees in their departments. It means we need managers who are able to detect concerning changes in their subordinates and intervene timeously to prevent unnecessary mental health conditions and their complications. More than anything else, we need managers who know how to create a healthy workplace environment, as well as subordinates who respect their managers. It should be noted that employee health wellness services are identified as one of the essential services that are available during the lockdown period. This is done in order to provide continuous support to public service employees, particularly those who are at the front line of the fight against pandemic. The Department of Public Service and Administration provides support to national and provincial departments through capacity building workshops that are conducted on an annual basis and targeting individual support to departments related to implementation of mental health programs in the workplace. The department again also conduct audits in all national and provincial departments in order to identify struggling departments and offer intervention timeously. Program Director, the truth is the normalcy change as well as the stress challenges experienced as a result of the pandemic continue to cause and increase levels of anxiety and fear. According to data provided by GEMS as the main medical aid scheme covering the majority of public servants, mental diseases are the fourth condition affecting 5% of the public servants after hypertension, diabetes, and hyperlipidemia. Further to this data, Further to this, data from Policy on Ill Health, Incapacity and Early Retirement, PILIR 2016-2018 reports indicate that the majority of PILIR applicants were suffering from mental disorders, which are the highest, affecting the majority of the applicants within the public service. It is evident that mental health has been a cause for concern in the public service, even after the advent of the COVID-19. With the pandemic, the situation might worsen, especially among the frontline and essential services employees. It is therefore imperative to strengthen the existing psychosocial interventions in the public service, and the DG mentioned this point. The stress caused by COVID-19 physical visible, in fact, what I'm saying, the stress caused by COVID-19 physical visible symptoms of coughing, headaches, respiratory challenges, and other identified symptoms can never be compared to the psychological and emotional scars, which are invisible, but could later translate to mental health challenges. As the public service, through our employee health and wellness, we must gear up for early intervention mechanisms. More so, in this challenging period of COVID-19, the employer has to ensure the maximum implementation of strategies addressed in the institutionalized 3 pillars, namely occupational health, occupational hygiene, and wellness management. Program Director, the work of the COVID-19 pandemic has brought with it a range of issues regarding added pressure on mental health. The Employee Health and Wellness Strategic Framework for the Public Service caters for the provision of psychosocial support in the public service. DPSA have had to look at the options of remote working for public servants, which lends itself to approximately 35% of jobs on office-based environment, lending themselves to such options. However, this is not adequate. To our public servants, allow me to reiterate that the wellness management policy for the public service, employee health and wellness practitioners in the departments are available to help you, and they will continue to offer psychosocial and counseling services should they be required during the lockdown period. Let us never hesitate to seek help when as we feel the need. Mental illness is an illness like other illnesses or diseases. The late Sitwalandwe Ubaba Umlangeni once said, one of the biggest prisons we were afraid of being locked up in was the jail of ignorance. We had to demand to have access to education, a fight that was fought over a period of 3 years until it was granted in 1967, close quote. As we continue to fight different struggles in our lifetime, the words of Babu Mlangeni profoundly resonate, reminding us never to lose sight of fighting against the stigma and discrimination attached to mental illnesses. We must never be ignorant to the importance of mental health education and awareness in the public service and our society at large. We should not treat mental health conditions any differently compared to other illnesses or diseases. As we conclude, we encourage public servants to observe all COVID-19 safety measures, that is to wash their hands frequently, to sanitize regularly, wear face masks, and observe social distancing in offices. Managers must ensure availability of correct use of personal protective equipment by all employees. I must state that it is our primary objective to ensure that our public servants continue to be in a state of well-being where they can realize their own abilities, cope with the normal stresses of life, work productively and fruitfully, and make a significant contribution to their communities. As the public servants, we are also members of society and communities. We are committed to serving the people of South Africa because we belong, we care, and we serve. God bless South Africa. I thank you, Program Director.
Thank you so much, DM. That was a very, very comprehensive keynote opening address. It nicely, put together the context of why we are here today and actually highlighted the importance of employee health and wellness as a management tool to ensure the health and well-being of employees, but also to ensure that at the end of the day, the services to the citizens of this country are delivered, by happy and healthy employees. So thank you very much. The information you shared about the fact that mental health challenges are actually the fourth reason for people to claim within GEMS, and the fact that when it comes to issues of ill health retirement, issues of mental health are actually the number one reason for people to actually apply for ill health retirement. So that information puts this whole discussion of today in the proper context. So thank you very much. Now we will call the first of our speakers, Professor Zukiswa Zingela. Professor Zukiswa Zingela is a specialist psychiatrist who is now the head of the Department of Psychiatry at the Walter Sisulu University Faculty of Health Sciences. She's somebody who writes quite a lot on issues of mental health. The current insert on the South African Medical Association July issue has got an insert that is largely written by her. There are other contributors as well, but she has contributed the most. She's very passionate about these issues, and she's been doing a lot of great work in the Eastern Cape. So with those words, I will hand over to Professor Zukiswa Zingela.
Thank you, sir. Thank you very much. And first of all, I must say good afternoon to the Honorable Deputy Minister and to all who are attending today. And thank you to our host, Dr. Fundile Nyati as well. And I must also add my voice to commend the opening address by our Honorable Deputy Minister, because it touched on very crucial aspects of what we need to be looking at today. What I'm going to do is just to give a sort of context about what I'm going to be talking about. I'm going to be making a few general points about mental health, specifically within the public service sector space, but I'm also going to be talking about, the general principles of what is important to have in place. And I'll touch on what a person within the public sector space can do to, first of all, be fully aware when they are well and when they are mentally unwell. And I will also touch on what they can do to help themselves. I think the most important part for me is for us to at least be able to walk away having gained something from spending a couple of hours attending this webinar. So if one then looks at the general principles, as the Deputy Minister has already indicated, it is important for employers within the public service sector to make sure that there are resources in place which support the employees' mental health. And this is especially crucial in the public service sector, mainly because we are concerned with service delivery, and we are also concerned with functionality of many government departments which have to work together and interact to make sure that the average person receives the services that they deserve. Just to mention that there are quite a number of advantages to ensuring the availability of resources that support mental health in the workplace. And these include achieving optimal productivity in your employees, creating and maintaining a positive work environment, and decreasing absenteeism, as Deputy Minister has mentioned. It can also help to eliminate, for example, behaviors like clock watching, meaning an employee, instead of spending time and looking at, the clock and saying, oh, it's 5 minutes before I'm about to leave, and then they start shutting down. If they're happy at work, it becomes a place where they want to be. And it also makes a difference to how employees feel when they have to, get ready to come to work. And if we then look at the different mental health resources that should be available at work, we've already heard the mention of employee assistance programs. We've already got an idea that there should be a staff health where the organization has an ability to provide that. It's also important to have a wellness services. In addition to that, however, it is important to highlight that it isn't just availability of specific resources, but it is also a certain type of behavior and management that one would require from the employer. And an example is being aware of workspace conflict and managing that proactively. That also supports the mental health of employees. Also being aware of difficult team dynamics in team settings or organizational settings, and doing things like taking steps to actively eliminate bullying. Other factors could be appropriate allocation of work responsibilities, which is done according to the worker's capability, paying attention to staffing issues like staff shortages, making sure that the work allocated is an appropriate workload, things like providing adequate resources and equipment to enable the employee to perform their jobs optimally. And I think lastly, it is also important to keep an eye on eliminating or minimizing unfair labor practices, because all of these factors actually impact on worker health. And I think one last thing to mention is that when the employer is then looking at providing resources for supporting staff, it's important that the provision of employee assistance programs are not just done as a tick box exercise. What do I mean by that? I mean, if I am an employer who is serious about providing this, it is my responsibility to then make sure that the person I appoint to be the EAP officer is somebody with the necessary qualifications. Instead of just picking on, any person just because they say they're interested, and then just putting them in that office. And then the last thing to mention is that when that service is in place, it is crucial that it should be run ethically, with confidentiality, impartiality, and a degree of sensitivity, so that workers can feel encouraged to actually use that service. Now, having touched on the employer's role, the next one for me is to look at what employees themselves can do to maintain their own health. And this, of course, will require things like knowing what is being mentally healthy for me. What is, what are the things I can do to look after myself and to help myself should I run into problems? And also, what are the things I can do to avoid running into problems or disturbing my mental health? When should I be asking for help? And what are the options that are available to me to access help when I need it? I think these questions are important because I feel that they do help to empower people in the workplace. And the first one I'm going to look at is what is an optimal state of mental health for anyone? We've had the WHO definitions that our Deputy Minister has shared, but I'm going to break it down into something a little bit more simple and closer to home. So when we're talking about mental health, we're talking about a state of emotional and psychological well-being that enables one to cope with daily life challenges and other average challenges. In that context, a person who is mentally healthy is able to fulfill their roles and responsibilities at work, at home, and in general social situations. They're also able to practice and apply problem-solving skills when they come across average problems. They can experience distress, even when people are mentally healthy, they can experience distress when faced with significant problems. But in general, when one is mentally healthy, one is actually able to manage and overcome, except when the challenges are really overwhelming for the average person. So when we are talking about an ability to help yourself and an ability to practice self-care, we're talking about quite a number of basic things that you should be able to do. And there should be an ability to recognize when you are stressed and what can affect your stress levels. There should also be an ability to recognize when you are in mental distress. And in addition, if one is then able to also build in daily activities that can enhance and support you to stay mentally healthy, it's an advantage. And we also encourage that one should be able to decrease activities that may disturb your mental health, especially when you know you are headed for a stressful time. And lastly, we also encourage that should you know yourself well enough to recognize when you are reacting or experiencing negative emotions or behaviors, then it is useful when you try to learn how to manage those so that they do not impair your daily functioning. So going on then very quickly to look at stress itself. When we talk about stress, what are we talking about? This is basically referring to how we feel or behave when we are under pressure for any reason. And usually you'll find that if it's average stress for the average person, we can cope. An example is if you're facing a job interview, you could it could push you to really practice to the point where you become almost word perfect so that when you go for your interview, you ace it. And then of course, there are other times when too much stress can be really overwhelming. And in that instance, we then describe ourselves as stressed. And in general, it is important to remember that people can have different reactions to stress. And when we talk about a reaction to stress, we sometimes refer to it as a stress signature. So what are we talking about when we're talking about a stress signature, and what does it help to actually know your stress signature? I'll describe a few things that can happen in the average person when they feel stressed. They may feel unsettled, they may feel worried, restless, unable to relax. They may also have physical symptoms like a fast heartbeat, a sense of panic, and pain in the neck usually. They can also complain of pains in the chest or burning in the chest. They can complain of an uncomfortable feeling in the pit of the stomach. Some people can experience a loose tummy. They can have headaches that just persist and persist. And then in addition, you will find other manifestations like disturbed sleep, your thoughts going around in circles, changes in your appetite. You may actually become easily irritated or with a short temper. It can actually affect your concentration as well, your ability to make decisions in general. And then you may get a sense that you're not coping. How then stress can manifest in different people will depend on a number of things, but you can have a combination of what I've described. And what can you then do to help yourself when you feel like this? The obvious thing in the first instance is to try and identify what is the source of your stress. Has something happened recently that has been bothering you? And you also need to ask yourself, is there anything that is within your control that you can do to at least change or try and adapt the situation? And once you have identified if there's anything you can do, the suggestion from me is write down a management plan for yourself or an action plan. Write down very simple steps, even if it's 1 or 2. And once the action plan is ready, break it down into smaller tasks so that it is something doable, and then try and set targets for yourself. If you fail to meet that target on that one day, it's not the end of the world. And more importantly, I think it is very, very important for you to look at the things that you can do, that you can control, like your sleep pattern, your eating habits, your physical activity, levels of exercise. Those are at least things that you can do something about. And lastly, just to encourage that if you're finding that some of the things you have identified which contribute to your stress are not something you feel are under your control, the next best thing is to say, what are the things that I can do that can help my reaction to the stress, even if I cannot control the source. And again, these are the basic things like your sleep, your eating, your physical activity, your connectivity to other people. And lastly, just an advice that it will be important to monitor your thoughts deliberately so that you can focus your mind on doing more activities that will enhance your coping, activities that you know tend to bring you pleasure, and to basically focus on making sure that if any activity is increasing your worry and your agitation levels, try and do less of that. What I'm now going to touch on is specifically the mental health aspects of COVID-19 because of the current pandemic. I'll do that in the next couple of minutes and then I will round off. So if we look then at the mental health aspects of COVID-19, we are aware that, you know, feelings of anxiety, of fear, of panic are reasonably normal during an outbreak or a pandemic, especially if we have got, you know, a high number of those who are sick and dying within a short space of time. And in this current state of the epidemic, we are aware that many of our provinces are experiencing a surge in numbers. So it is normal to actually see these reactions in everybody around us, but more prominently in those who are immediately confronted with dealing with COVID-19. This includes our frontline healthcare workers and other essential workers. There is a recognized increased risk of developing mental disorders. These will include difficulty adjusting, acute stress disorder, post-traumatic stress disorder, depression. We also have to recognize that there could be an increase in substance-related problems or disorders, which then ties in directly or indirectly with the current ban on alcohol, for example. There should also be a sense of loss or sense of grief, specifically in those who have been faced with economic hard times, job status being lost, or social status coming down. And then lastly, of course, with the death of loved ones, including friends and family, one can then expect, you know, significant grief reactions. And what we are then saying is that when it comes to frontline healthcare workers, we recognize that a significant amount of them will be faced with these problems that I have highlighted. And to echo the statement from the Deputy Minister, it is crucial that we set up support services for them. I'm aware that different organizations have already started doing this. I'm aware that different government arms have also started doing this. And from my side, I think it is important to reiterate that because frontline healthcare workers represent the first and last line of defense in this pandemic, it becomes crucial for us not to drop the ball and to make sure that each and every frontline healthcare worker has access to interventions when they need them. And then just a last few words of encouragement. Wherever we are in the workplace, it is important to keep an eye on safety to make sure that we do not get infected unnecessarily. It's important to try and keep ourselves calm, even if it means we have to use relaxation techniques to do that. It is important to focus on what things we can do to help ourselves within our environment, and to also reinforce that idea of connectedness and connectivity to your team, to your colleagues, to family, to friends, and lastly, to keep hope alive. I will stop there, Dr. Nyati. Thank you so much.
Thank you so much, Professor Zingela. You covered it very comprehensively. So many people sometimes don't understand what stress is. We talk about stress every day, but you know, you went to town, you know, helping us to understand what stress is and what needs to be done. But specifically on the COVID-19 pandemic impact, you also went in there and highlighted the issues around anxiety, the issues around fear, the issues around, you know, people who present with mental health disorders, you know, the type of disorders like anxiety disorders, acute stress, PTSD, depression, substance abuse, and also the issues around grief, because some of the people, they have lost their, you know, people that they were working with and they haven't had time to grieve them properly, but others have lost their family members, and because of the COVID-19 rules, where somebody must be buried within 3 days, and there's a limitation in the number of people who can attend, so the grief process is definitely a different grief process to what people are used to. And if that is not dealt with appropriately, obviously it may affect how they work, how productive they are. So thank you very much for that comprehensive speech. And now I will move over and call Dr. Sipho Sinabe. Dr. Sipho Sinabe is previously, or he was the previous Chief Director of Employee Health and Wellness within DPSA. However, at this point, he is working as a Chief Director within the Gauteng Department of Health. And when I was talking to him before this webinar, he shared a number of innovative things that that department is doing to try and support their frontline, staff who are exposed. As we all know, that Gauteng is now the epicenter of COVID-19 in South Africa, with more cases than all of the cases that were found in China. So with those few words, Dr. Sipho Sinabe, please, the floor is yours. Dr. Sipho Sinabe? All right, I don't seem to find Dr. Sipho Sinabe. I think I will move on to the next speaker, and when he joins us, then we will get back to him. Let me ask Dr. Alwalia, the Chief Executive Officer of Higher Health, which is an agency within the Department of Higher Education and Training. They have just launched a very comprehensive program of mental support for all people who are in tertiary institutions in South Africa, and also for all the tertiary students. They launched this yesterday. It's a comprehensive program with 3 levels, primary, secondary, and tertiary level. But let me not steal his thunder. Dr. Alwalia, please, the floor is yours.
No, thank you, Dr. Niati. This is a huge honor for me to address your webinar. I also would like to acknowledge the Deputy Minister and her presence from Public Service. Also my fellow panelists, a warm welcome from my side. Higher education, everybody thinks about higher education and the first thing that comes to our mind is universities. But we've got 5 subsectors in the entire PSET system, which is post-school education and training. We're talking about universities, we're talking about TVET colleges. We've got 300 sites across this country in one of the most rural informal settlements, in areas which is absolutely where we always say we've got 2 South Africa in the same South Africa, and specifically the most disadvantaged population. We've got CET colleges, which is community education training colleges. And we've got about 18... And we've got about 1,800 centers for the CET colleges around this country, 1,800. And that's another big subsector of the PSET system. We've got another 4th sector, which is skill-based learning, the work-based learning centers. We've got CETAs, we've got police academies, we've got this huge program with automobile industries or fishery industry and work-based learning. The 5th subsector we have is private higher education, and which is growing very fast. And about 20% of our student community in reality comes from private higher education. And that's the public system with small element of private higher education, but the entire public system is built on higher education on this magnitude. We've got a population. The public higher education system caters for about 2 million South Africans in the post-school education system. And Dr. Nyati, the reason why I took this long journey of explaining the post-school education and training system is primarily because I wanted to address that if we are looking at mental health for students and mental health for staff in this entire massive system of ours, we have to ensure that no stone is unturned. What services are available in UCT or WITS, which obviously is quite in the magnitude of a very critical enabling institutions of higher learning in South Africa or recognized in Africa. We also have mechanisms to support student and staff in Bizana, in our campuses in Ladysmith, in Kailicha, in Mount Frere, in any part in South Africa, whether it's rural, informal settlement or urban. And it caters for everyone. And this is kind of what national health insurance is all about, is making everybody having easy access to health to the entire public. So from that angle, we have approached mental health in a way that, and in my own experience, I always feel that most of the times, mental health comes at times which are after work hours. It comes at the time at 11 o'clock, at 1 o'clock. A student or a staff might want to commit a suicide at 2 o'clock in the morning. And that mental health means you are all alone. And the aim is, how can we reach out to our people and say they are not alone? And it's a pandemic that affects all of us as humans. And how can we provide service even at 2 o'clock, where we can at least make sure that the person is not alone? How do we build the resilience of our student community, our youth, so that when they are growing older and they go into our economy, which is the workforce, they are strong enough mentally, psychosocially, that they can contribute into the economy? I must remind everyone that 92% of formal workforce of South Africa comes from post-school education. Even a waitress at a mug and bean who serves you come from one of our TVET college with the qualification of hospitality. Our entire fishery industry in the Zululand area, our whole automobile industry in the Eastern Cape, agricultural, mining sector, plumbing, electrical, from TVET colleges, from CET colleges, universities, from high skills that makes our country grow. And our economy, on a hope of a mother, for me, as an Indian man, my mother, I pay for my child's marriage or my brother's children's marriage, for that education. We call it black tax, we call it an Indian tax. But whatever it is, we are sole earner of a family, and our responsibility is to look after the entire family. So when you're looking at that member of the family, and when it's in the budding stages of youth, coming out of institutions of higher learning, can we not build a program around them that brings resilience, brings strength, and brings them mentally strong so that they can grow into effective graduates and effective citizens? So Dr. Nyati, our program is based on that concept. Building support at a level that even at 24 hours even at 2 o'clock in the morning, the person doesn't find themselves alone. And to the last level, which is tertiary, so primary, secondary, and tertiary. So in the primary level, we have a very big peer-to-peer program. We've got about 5,000 foot soldiers in TVET colleges, in universities, in CET colleges. We build this for HIV, we build this for TB, we build this for other epidemics. They're even helping us with our COVID-19 as we speak. That's how we've opened our sector gradually and phased approach towards putting systems where everybody can be screened every day and isolated at early stages so that we cannot let the spread of COVID-19 happen. So with peer-to-peer, we have now developed a second curriculum through the Health and Welfare CETA and National Skills Fund that is now running across all institutions of higher learning. And this second curriculum might not be mandated with an exam, but attracts about more than 1 million students every year to just learn an interactive way of health education, education on HIV, education on TB, and now we have put up a curriculum for mental health. Every student who undergoes the mental health curriculum in post-school education also goes through a screening tool. And with WHO, we produced a mental health screening tool that every student at the age of 17, in TVET colleges, we see intake from 15 years, 19, our staff members, they can screen themselves and find out whether they are at a risk to any mental health epidemic. Suicide is the second biggest cause of death in higher education. And that's how pronounced mental health is within the post-school education. And we can imagine the amount of stress, substance abuse, and other challenges that the sector grapples when it comes to higher education. So from the primary health, which is peer-to-peer driven WHO screening tools, we have a second layer now, which we launched yesterday, is a toll-free 24-hour helpline managed by social workers, psychologists, psychiatrists in support with South African depression, anxiety, SADAG. So 24-hour helpline is purposely built so that at 1 o'clock in the morning, if a person finds himself feeling alone, feeling anxious, feeling stressed, which is building up from many stressors around, the person should not find himself alone. There's help. It is totally free. Pick up the phone and there'll be somebody who will guide you, will help you at 2 o'clock in the morning, counsel you, take you through the journey. And from the second layer, we are building a tertiary layer, which is clinical psychologists, help of psychiatrists. Now, the clinical psychologists we need in all 11 languages, and we're building it in every district around South Africa. And the aim is that from the second level, the person can be referred to the tertiary level so that further follow-ups, further care. And then it's integrated to the district Department of Health so that we can connect it to the district mental health units and stuff. Mental health is an interconnected pandemic with HIV, interconnected pandemic to our economy, to COVID-19, to substance abusers, which is predominantly extremely high among the youth, is interconnected to gender-based violence. It's interconnected to all the epidemics that we talk about in South Africa or in Africa. So this pandemic need not be taken separately. It's a pandemic. So it not be taken separately. It needs to be integrated with all the pandemics. Yes, COVID-19 pushed higher education to go to the second and third layer very quickly, which we were planning in a phased approach of opening. But COVID-19 has made us realize that how mental health is in reality a pandemic that no government or no organization in any part of the world can ignore. And we're sitting on a time bomb that we need to absolutely pay full attention towards. So we hope that a comprehensive program on mental health and a phased approach of mental health, of support of 24 hours to our public servants, which are our staff, our public students, which are coming into our institutions of higher learning, and building an economy through resilience will be our biggest effort going forward. I'll take more questions, Dr. Nyati, but I'll stop here. Thank you for allowing me to express. Thank you.
Thank you very much, Dr. Alwalia. It was important that we hear a voice from the education sector. As I mentioned earlier, that whilst everybody in the public service is affected, but at this point, some sectors within the public service are much more affected than the others, and the education sector certainly is one of those, not only at tertiary level, but also at primary and and at secondary level under DBE. So it's important that we hear what are the good things that you guys are doing in the tertiary level, so that some of those best practices can actually be, used at the lower levels of the education sector. Now I will move on and call Dr. Mahlangu from GEMS. GEMS is the biggest medical aid that provides for health services for employees of the public sector. So over to you, Dr. Mahlangu.
Good afternoon, everybody. I'd just like to acknowledge the Honorable Deputy Minister, the DG, and my fellow panel members, and all of those who are attending this webinar today. Thank you for this opportunity to address all of you on mental health from a GEMS perspective. As our Honorable Deputy Minister advised, mental health is number 4 in terms of chronic conditions with our GEMS members. So today I am going to speak about mental health, a GEMS perspective. And from this perspective, it is from when people seek treatment. So after you've been identified, what happens when you seek treatment? So I just want to share a quick presentation with everyone.
You can go ahead.
Okay. Hold on. Sorry about that. Technical glitches on a Tuesday. Okay. Sorry.
No problems. We'll be patient.
Thank you very much for everyone's patience. There we go. Okay. Now I have it going. So I am the Senior Manager Medical Advisor for GEMS, and I work within the healthcare management section within GEMS. So today I'm just going to talk about the burden of disease, the benefits available, and some of the challenges that we have noted as GEMS. So I will show a lot of numbers just to give everyone a perspective that once the screening has been done, once people have gone through employee wellness, what mental health conditions are we seeing as GEMS? What trends have we noticed before and during COVID? So that's 2019 experience, our experience beginning of the year before the lockdown, what happened and what has happened during lockdown. Just for feedback, GEMS, just for some background, GEMS is the second largest scheme within the country and the largest closed or what we call restricted schemes within the country. GEMS currently caters for 1.9 million beneficiaries, which is one of the stakeholders within government. So with regards to burden of disease. So here we have what we call our mental health disease management program. So when someone is diagnosed with a mental health condition, they are then registered on what we call our disease management programs, where they are then counseled and we monitor them. So you'll see that as of June 2020, we had just over 72,000 GEMS members registered on our mental health program. And you'll see the increase from 2020 to June, 72,000, and 2019 at 62,000. So even during the COVID period, you will notice that there has been an incline in the number of people being diagnosed with mental health conditions and then being subsequently registered on our disease management programs. So just in terms of admission, this looks like a very busy slide, but just to break it down to very simply, what we did was we broke it down according to age groups and prevalence and admission. So you'll see that our principal members is what's in blue, and what is in red are all the dependents that principal members then register them on. So you'll see that our highest rate is in within 60 to 69 in terms of diagnosed with conditions, right? And highest is also 70 to 79 with 34.3% prevalence. But if you look at it, if you look at the working group, the main working age group within the government sector, and you just look at from 30 to 59, that is a huge population that have currently been diagnosed with mental health conditions within the public sector. So we also break it down according to three main and common mental health conditions. So schizophrenia is not very common, however, it can be quite debilitating. And what you'll notice is that during March, when lockdown started, there was a complete decrease in the rate of admissions because healthcare providers were advised that, you know, it is time to let's decrease the amount of admissions and look at beds. And also members themselves, in terms of health-seeking behavior, we noticed that some members were staying away from being admitted unnecessarily. And you'll see the same thing in depression and also in bipolar. So however, it was very interesting in bipolar is that there was actually an increase during lockdown. So it means that there was a negative impact on those members who have bipolar mood disorder. However, those admissions rates have subsequently decreased. Some other things is that healthcare providers have now decided to manage more members as an outpatient, intensive outpatient therapy, rather than having them admitted in hospitals. But we have seen a pickup within the admissions within mental health conditions. So we do see that as the lockdown has begun to ease, people are tending to also need admissions again. We also then looked at readmissions. So members who have been admitted within 30 days after their first admission. And what we did notice is that so far for this year, we have had a decrease in the rate of readmissions, down by 16.3% to 6.8 in 2020. So once again, as I explained, we don't know if it's due to health-seeking behavior, is it the impacts of lockdown, that members are more afraid to be admitted and prefer, you know, to see their treating healthcare providers and psychologists and other healthcare professionals on an outpatient basis. You'll see the sharp decrease that we did see in March when the lockdown did happen. This was also, we look at a certain population within our GEMS, and these are members who have multiple mental health admissions. So these are what you would call our high touch members who have had 3 or more admissions per month per patient. And you can see it's a very small and select number of patients. And once again, you'll see pre-COVID and during COVID. However, you'll notice that during lockdown, there was an increase up to 15 compared previously in 2019, and it has subsequently decreased. So hopefully, we are hoping that it means that these members are being better managed as outpatients, and also maybe members being able to work from home with increased home support and having family around there has also maybe lessened any stressors or environmental stressors that they may have. So what benefits are available to members when they are diagnosed? So for in-hospital benefits, we have their PMBs, which are your prescribed minimum benefits, which are dictated by the Council of Medical Schemes that require medical aids to pay for these conditions. So we have those. Those are covered by GEMS. Then we have other mental health care conditions that you can be admitted for, and those are just subject to protocols and pre-authorizations and those. So if you're admitted for any type of anxiety or obsessive compulsive disorder, then those will also be, funded for as per the scheme rules and at the scheme rates. Out of hospital benefits, once again, your prescribed minimum benefits as per dictated by the Council of Medical Schemes. Then we have other mental health conditions that we cover for in terms of chronic, that we see them as what you call chronic conditions, which is anxiety and ADHD. And a lot of people also need to remember that CMS also says that members get 15 days out of hospital or 21 days in hospital for their PMB conditions. And if your benefits are finished, if your PMB allocation is depleted, then we can go into what available benefits does the member have. So as I mentioned, we have a disease management program with currently have over 72,000 registered members. We have registered counselors available that speak to members and follow up with them on a regular basis, and can also offer that form of counseling to them to find out how are they doing, how is their well-being, are they taking their medication. Your registered counselors are mainly available in English. However, if you would like to speak to a counselor in any of the 11 official languages, that can be arranged for you. Since COVID, we have also had telehealth consultations, which we have extended to create access to care during the COVID-19 pandemic. These include psychiatrists, psychologists, registered counselors, social workers, and including psychiatric nurses, so that members do not physically have to go to doctors' rooms. We have additional coverage beyond PMB PMB care for even our lowest options. So for example, Tanzanite 1 and Beryl, which are our lower options, they also have access to cover for chronic medications and admissions for anxiety. And members are also welcome to apply for ex gratia, for example, when their benefits have been depleted for medication or even require extended length of stays within hospital. Just to give quickly on the challenges that we have faced, as you'll see, compliance to psychiatric treatment. If you'll notice that our compliance for 2020 is actually below our compliance levels of 2019. It dipped slightly after the lockdown, and it's slowly starting to climb. And that's another thing that we've realized. And some of the things that we have picked up is care coordination. Our members not necessarily starting off at GPs, helping GPs to assist them in coordinating and dealing with care, because GPs are also there as your primary gatekeepers of primary healthcare. And even just the stigma and delayed diagnosis, because stigma also leads to delayed diagnosis. And we find that people are seeking treatment late, people are reluctant to discuss their mental health problems and issues. And I think especially now during COVID, it is very important, and it has shone a light on the importance of our mental well-being. And we're hoping that now that we'll get better compliance from our members and also be able to assist our GEMS members better. Thank you very much. Thank you, facilitator.
Thank you very much, Dr. Mahlangu. We are still experiencing challenges with Dr. Siposinabe. He seems to be having some bandwidth issues, but as soon as he is able to join us, then we will give him time, but we'll have to move on. So all three of our guest experts have delivered their presentations, so this is the time for people to submit questions via the Q&A, but We'll also look at questions, you know, because I've promoted a lot of people so that they can be able to just unmute and then we take the questions. So please raise a hand. There is a function for you to, you know, raise your hand electronically so that we can then be able to call your name and you can pose questions to our panel. Oh. Can we take questions for our panel? Just raise a hand. There's a function there on participants for you to raise a hand. Ladies and gentlemen, this is the time for you to pose questions to our panelists.
Prof, Doc, sorry.
All right, who is that? Please.
Mushi.
Okay, Mushi, yes.
There are questions already in the Q&A. Perhaps we could start with those.
Okay, please pose the questions. Yeah, just read them, those that are in the Q&A.
Okay, we've got the first question from anonymous attendee. What is DPSA doing to ensure that government departments qualified EAP professionals, given moratorium and cost containment, particularly departments that are already have incumbents without relevant qualifications?
All right. So that's basically, I think that question, it comes from the point that a number of departments are supposed to have EAP, you know, robust EAP programs in place. However, the capacitation of those programs, it becomes, or it has been a challenge for most departments from a funding perspective. So this person wants to know what needs to be done to ensure that departments capacitate the EAP unit even better with people who have got the necessary qualifications. Is there anybody in our panel who would like to take that question?
I think the question is posed to DPSA, or I see Deputy Minister is on.
Okay. Okay.
Yes, Program Director, thank you for the question. As I was sitting here, I was actually thinking that as a way forward, we have got to, particularly in preparation for what we all think is going to happen, the increase in the number of mental illnesses, talk to the National School of Government to include first mental health as a course that they offer at the National School of Government, particularly for managers. That's the first thing. The second thing, we actually were saying the department should check with all departments whether they do have capacity and capability within those units in preparation for the increase in the numbers of public servants that actually can present with symptoms and signs of mental illness and illness. Of course, the training of officials in that unit has to be continuous within departments and be part of orientation that is given. But I agree with the person who's asking the question, because in most departments, the health and wellness units are something that gets forgotten by everybody, unless maybe it's somebody who has interest in them, and then they become an issue. And it's something that we'll have to talk first to politicians, but secondly, and ensure that there is somebody, whether the deputy minister or minister, who have these units delegated and this responsibility delegated to him or her, so that there is a politician who has got interest in the working of the unit. That's the first thing. But also to ensure that even DGs take interest in these units, as of course you have seen our DG taking interest, and ensure that they continue to function. They have done some work. They participate in a number of other issues, like we are saying, mental health takes, backseat in many of the departments, but even in our society, even in the Department of Health. I visited one of the hospital. It's got beautiful wards, renovated and so on. But when they took me to the unit for mental health, it was the old hospital, not just old, but something that you don't think a person can live in a hospital and in government. So that, and it was typical of what happens everywhere. And I think this also happens even in the public service. And our view is that we have got to elevate this. And therefore the issue of mental health should go beyond June. It should be something that we talk about every time we alert people about it every time. So I think that for me is important. That's what we can do. And if it calls for us to send out norms and standards, as the department will have to review and send out those norms and standards. Thank you.
Thank you very much. Thank you very much, the Deputy Minister. I think your answer should, satisfy the person who asked the question, because you are saying, whilst you are acknowledging that some departments may not have capacitated the EAP units, but with the impact of COVID and also post-COVID, what is being, projected, it's going to be important for departments to find a way to capacitate those units. So I think it is one of the things as part of the way forward that needs to be, put down, and hopefully it will be acted on. Money is very tight in the public service. However, there will have to be a way to find some money to ensure that people, are actually employed appropriately qualified people to provide that necessary support. Thank you very much. Another question. Is there another question? Okay, there's a question here that says, given COVID-19, how do you see the future of group counseling, that is face-to-face sessions? Maybe this one, I'm just going to ask Professor Zugiswa Zingela to just, give us a view on that. The point here is that people are a bit scared to get involved in group or face-to-face type of, counseling sessions. And so what alternatives are there, that could be used to try and ensure that people still get the interventions, but in a virtual way?
Okay, thank you for that question, Dr. Nyati. It is one of the innovations that we've been forced to come up with, and that is being able to provide distance support where one can, in order to avoid, contact or direct contact that may increase chances of infection. So one can do that telephonically, one can do that virtually through meetings like Zoom or other panels or virtual instruments like Teams and so on. And then lastly, it does not take away the ability to do or offer face-to-face sessions where possible. And one of the things that we have done to try and sort of increase our capacity without increasing chances of infection is we've also gone as far as doing small groups, small in terms of number allowed per session, but enough to reach more than one person at a time. And of course, when one does that, one has to keep an eye on safety and making sure that everybody's wearing masks, they social distance, and they are able to wash their hands. So one ends up having to do a mix of these things. And of course, one judges depending on the need of the receiver, whether this is something that can be done telephonically, virtually, or face-to-face, or via group or individual. So there's many options.
Hello, Doctor. Should we pose the next question?
Hello? Hello?
Hello, Doctor.
All right, sorry, I was actually on mute there. My apologies. I was just trying to say, just to add on what Professor Zingela has just mentioned, that there are alternatives to face-to-face, but face-to-face can still happen if the right measures have been taken to prevent, infection. So in places like China, there's been a drastic rise in telecounseling services, use of internet for counseling, and also in the US, the same has happened. So I think it's the new normal that needs to be adopted here as well, because very few people want to venture into places where they are not sure about, whether they will be at risk or not. But face-to-face counseling still does take place. All right, let's take another question. This one is for Dr. Alwalia. How do you assist the students now in rural areas due to the closure of academic institutions? This question is from Matlakala Musane. It's for Dr. Alwalia.
No, thank you very much. I think it's a very important question. And I started my presentation emphasizing that campuses in rural or campuses in informal settlements are always our predominant ways of thinking around how do we provide services to them. Now, the campuses have opened. 33% of students have started coming in, and the priority were those students who are on practical courses at this stage. In TVET colleges, in fact, we've opened most for our student population, but they do not come on every day. They come alternate days, but they attend the same classes, because in specific courses, you cannot do learning online and you have to do practical learning. So we do see lots of students coming on campuses and asking for services on the campuses. But there are many students, both in rural, informal settlements and urban areas, that are not accessing our higher education at this stage and are alone at home, insecure about their career, insecure about their future. And we've really seen that being built up quite tremendously in that. So that is why we launched a toll-free helpline 24 hours. And this is predominantly for any student, whether you are in a rural area, you don't need internet. All you need is access to a call. It's totally free, 24 hours. And you can pick up the call, and there it is. Somebody, anytime in life, anytime in the hour, will be able to provide that support. Whether you are in Bizana or you are in Johannesburg, irrelevant. The call applies to everyone. The other important thing is that we have now started a fleet management program where our nurses with community healthcare workers and psychologists will be routinely visiting predominantly our rural campuses. And we are trying to make it like a planned approach where we have so many sites across this country, we cannot have a full-time capacity, but we're saying, how can we schedule appointments? So if these phone calls are coming on routine basis, we are documenting, we are providing support. Some of these clients or some of these patients or some of our students will need tertiary support. And when they need tertiary support, there will be a clinical psychologist who they will be referred to. And if the number of cases are high in a particular campus in a rural area, say Mount Frere, in our Ingwe TVET college or a Rikala TVET college, then the psychologist will go there and give a full, go through the whole list and fix appointments routinely so that proper care and support mechanism is followed. For any reason, the tertiary system is not able to take care from the post-school education. A linkage to Department of Health through the mental health clinics will be done. So irrespective you are in rural, irrespective you are in urban or in informal settlement or wherever, as long as you are a young person, a student, or a staff member, you will be able to get support 24 hours when it comes to mental health. And that, I think, Dr. Nyati, will be the way forward for us.
Okay, just another related question that was posed by somebody here. What is the toll-free number that those people who work in the tertiary sector are supposed to call, the one that you launched yesterday? Is there a way that maybe you could write it on the chat function so that people can then be able to know that number? Hello? All right, another question, I think this one is for Dr. Mahlangu from GEMS. The person is saying, it's interesting to see that GEMS recorded only schizophrenia, bipolar mood disorder, and depression. Literature out there is reporting high levels of anxiety from fear of the virus and loss of life by health workers. Is there a specific reason why anxiety was not picked up by GEMS? So that's for Dr. Mahlangu.
Hi. Okay. Yes, that's actually a very interesting question. Currently, right now, we are not really seeing any anxiety, an increase or very many anxiety admissions due to that. So I would assume that if a person needs admission for anxiety clinically, it must be a severe form of some generalized anxiety disorder. So what I did present was those top 3 main conditions that trend within GEMS with regards to our admissions.
All right, there's another related question, Doc. Does GEMS have a plan on how to assist departments to address these cases on disease management programs? Do you have something in place for wellness screenings to increase awareness of health status? So I think because we are talking around mental health issues, do you have, as part of your screening programs, mental health screening, that people can either do, remotely or, in other ways?
Okay, so previously, pre-COVID, pre-lockdown. So let's go back to the old normal. So in the old normal, departments were very, there was a process for them to apply to GEMS, to have wellness days and screening done for mental health, cholesterol, all other type of chronic conditions, hypertension, HIV. So during lockdown, obviously we had to stop those face-to-face wellness screenings and issues that have taken up. And during the lockdown period, we are revisiting as to how can we further assist departments in terms of mental health education and any other requests that they may have. So what I can do is I can take this request of mental health awareness and education and take it back to our wellness section so that we can come up with something as GEMS to be able to distribute that to the relevant government departments and our stakeholders so that that can also be given to our public health, to our public employees.
Okay, thank you, Doc.
Thank you.
There are a number of people who have asked questions around the issue of stigma that is prevalent out there in society and even the workplaces when it comes to mental health. Now, I would like the panelists, maybe Prof. Zingela, can you just maybe share your thoughts around the issue of stigma in general? And if the DM is able to also just say what can be done in the public service to ensure that stigma and discrimination of those who've got mental illnesses is actually reduced. And this is in the context of the fact that there's been a number of researches that have shown that whilst 25% of people who are employed in South Africa have got mental illnesses, but only a fraction of those do actually seek help or even disclose their mental illnesses. So I think Dr. Zingela and maybe DM as well.
Okay, thank you for that question. Stigma is actually a huge obstacle to accessing services for those with mental illness. It doesn't just happen in the workplace, it happens at schools, it happens in people who are no longer employed, or even the elderly. And part of the issue is the perception that when you are mentally ill, you are impaired in an irreversible way. There's also an assumption that once you become mentally ill, you will never become right again, and therefore you'll never be able to take part, in a responsible way in taking decisions and stuff. Unfortunately, what we also find is this is not only external stigma, that is stigma practiced by other people towards me with mental illness. It can also be self-stigma where I underestimate my abilities and I do not go for specific opportunities because I assume because of my mental illness, I will not be able to do that. So I think there are two important ways where one can actually direct efforts to changing. First of all, it is important for people to be aware what mental illness is, and more importantly, that it can be managed and it can be treated. As Deputy Minister has also highlighted, this or most mental illnesses come in an episodic nature, just like you have episodes of high blood pressure, high blood sugar. You can also have episodes of disturbed mental health. And once those episodes are treated, the person is then able to function reasonably normally and reasonably well. And therefore, it becomes important that in the workplace, there should always be space created for people to be able to declare their mental illness, first of all, and for people to be able to seek help for their mental illness. So the only way we can fight stigma is for everybody to be fully aware that mental illness is just like any other illness, and it can be chronic, but it can be managed. And once a person is stabilized on their medication or whatever other intervention, there's no reason why they cannot be fully functional.
And Doc, just whilst you are there, Prof. Singela, there's somebody who has asked a question, is mental illness hereditary? You might as well just... Yeah.
That's actually a very good question. We know that a lot of mental illnesses can have a hereditary component. Having said that, if I am somebody who has a mental illness, it does not mean that each and every one of my children will have mental illnesses. What we find is that you carry a genetic vulnerability to develop mental illness, but it interacts with a whole lot of other things, including your environment, whether you get a head injury or not, the type of upbringing in terms of major stresses you're exposed to when you're growing up, trauma, and so on and so on. So yes, it can be hereditary, but there are many other elements that actually interplay with the hereditary nature to determine whether you suffer from mental illness or not.
All right, thank you, Doc. There is another question. I just want to find out if there is any service from DPSA that is able to assist educators with their mental health besides them going to hospital or doing private consultations, because somehow they are very much impacted by COVID. In my opening remarks, I did mention that some sectors of the public sector, like the education sector, are actually much more impacted. Some of the stuff that we see, as we work with the departments, is that indeed the levels of mental health challenges amongst educators is quite high. So maybe this question, together with the previous question, DM, if you can be able to just give your take. Is DM still there?
I think the professor covered the first question very well. Yes. For me, is to emphasize awareness, education, so that people know that anyone, including myself, can actually suffer from a mental illness. Anybody can. How we deal with them, and the professor covered easier ways of dealing with mental illnesses and dealing with stresses that we're exposed to from time to time. And as the professor has said, the heredity of it, hypertension can actually run in families, cancer, and many others. So it's not just mental illnesses only that can be hereditary. And I think it's important that people get to know about these things. That my father was asthmatic, I am asthmatic, but many of my family members are not asthmatic. So it can happen, it cannot happen. And as the doctor has said, so it's not like it's unique to mental illnesses only, it can be any other. And I think that message is important, in that mental illness is not different from other illnesses. But I think that in our families, uma sithethisa umntwana uyahlanya wena. And that makes the child, as he or she grows, to understand that ukuhlanya or something like that, kusho ukuthi you are crazy and therefore you can't talk about it, it's something ill. And that has to change in our communities. And I think the awareness programs are important. On the issue of teachers, even if I didn't get the question very well, but in my speech, I did indicate that we do have the wellness management policy for the public service. And we said it is important that departments and members of public servants do avail themselves to receive that psychosocial or counseling services from our health and wellness units that we provide for free. And I think there is, another question that actually says we might have to change our approach as these units, because for all the time, all that we do is to check blood pressure, which is important, test urine, which is important, check cholesterol, which also is important. But maybe we might have to add other things that talk to mental illnesses, and doctors are here to help us to identify better means and ways of doing that, so that we also make our public servants aware of this important medical, in fact, condition, or which is mental condition. So I think that will be the answer for me that I can give on the question, if that answers the question, because I can't remember the question that much. Thank you.
No, you were actually spot on, DM. You answered the question. I've gone through a lot of other questions. Some of them are not really relevant. It's somebody who clearly watched the video that has been circulating today about hydrochloroquine, but that has got nothing to do with the topic of today. So we are then, going to jump that. Right. We can still take more questions, either, through the Q&A, or actually those people who are, put as panelists beyond the speakers. They can also just raise their hands so that we can be able to see who has got a hand that has been raised, and then we can take the question from there. At this moment, there is no hand that has been raised. I don't want to pick people up randomly. It's not good to do that, but we're still there. All right, I think I can see the DG still around. I thought she was attending another meeting. DG, do you have any answers that you would like to give with respect to, there's somebody who has commented here that the current employee health and wellness programs seem to be very reactive rather than being proactive. So this person is saying there needs to be a relook on the EHW strategies, and also making sure that the activities are actually encouraging people to take more responsibility and are more proactive.
Thank you, Doc. Yes, I had gone quickly to join the audit committee, so I'm shuffling between two meetings. This webinar and the audit committee, which is sitting, we're approaching year end, so we must also account as public servants on a number of issues. I just noticed a few questions that have been sent by the team, and Deputy Minister has answered some of those, and I think the experts as well have spoken to some of those. But I just want to also clarify that the role of DPSA is that of really providing a policy framework, providing a guide, providing norms and standards. But the departments and the provinces, the national departments and the provincial departments are the implementers. And on an area of this nature, so it is a decentralized responsibility. That's why each department would have a specific service or an approach in respect to how they deal with health and mental wellness support for staff members, guided by the broader policy that framework and policy that we have issued as the Department of Public Service and Administration. So I just wanted, because there's very specific questions, what can we do for this one? What can we do for this one? From our part as the department, we provide that support and guidance and policies and frameworks when necessary. Usually would provide a policy framework, and the departments would have specific issues informed by their own environment. The environment, for instance, that the South African Police Services deals with is different from an environment that a DPSA you have to deal with when you deal with these matters. Then there was a question about the process of grieving, if there's any support we give for the we give. The support broadly is around health and wellness, but there's no leave. The leave that we have for grieving in respect to COVID, there is a compassionate leave that is part of our leave regime. So it is expected that people will tap into that kind of leave as long as it's accessible and available in respect to dealing with things like grieving and etc. But there is no specific leave for grieving in relation to COVID, as the question was raised. The proposal that is being made around the need to relook at the EHW strategies and whatever, because they are currently I think the person feels they are reactive currently, they are not proactive. I think we take that feedback, and as part of the processes we're engaging in of reviewing our policies, of course we will have to look at how best do we sharpen them and make them much more proactive. There was another question I noticed about, somebody was asking, are we doing enough to deal in response to COVID and mental health and wellness issues in the public service? And my sense is COVID, it's a pandemic we all know little about, and we're learning as we give responses in relation to a number of issues in relation to the pandemic. So I wouldn't sit here and say we're doing enough, but I would sit here and say there is commitment to do more and to provide the support, to provide the care, and to respond in a manner that is responsive and allows for public servants to continue to do their work, and those who are unable to do their work because they are affected or infected, there's circulars that have been issued, there are decisions, there are protocols that have been put in place to guide on those matters, so that they can be able to stay at home and recover as and when it's necessary. And we issued particularly the leave directive that were issued by the Minister for DPSA, which are quite extensive in terms of kind of leaves that are applicable in terms of the public service in relation to COVID, and that can be tapped into as well. But we've issued actually about more than 21 circulars as a department, the last time I count, just in relation to issues related to COVID, how we deal with guiding departments on how we deal with service delivery issues, and how we deal with issues around managing the spread of COVID within the work environment mainly. So there's been lots of work and lots of response, but I wouldn't sit here and say it's sufficient, but I would say the effort is there and the commitment is there to do more. As and when the evidence, we're guided by evidence as well, by science, as and when science comes out with information and evidence, then we should be able to respond as public service and further see how we can improve and how we can support and empower our colleagues and the public service generally to function under the current pandemic. Thank you.
Thank you, DG. There is one participant, Angela Montana. She's written quite a number of responses to the issue around the quality or the proactive versus reactive EHW programs. So I'm just going to ask her to actually unmute herself so that she can then provide the answer because she has written extensively, on the chat function. Angela Montana.
Hi, Dr. Nyati.
Yes, please. Yeah, please. You can also switch on your camera so that we can see you.
Can you see me now, Dr. Nyati?
Not yet, but you can continue with the response.
On the issue of wellness programs being reactive, the challenge is that, as one of the doctors has already mentioned, people are still not comfortable talking about.
Oh, where's she now? All right, we've just lost Angela. I'm not sure if she she muted herself or not, or she just had some technical problems.
I had technical problems. I'm back now.
Please make sure that you don't mute yourself whilst you're talking.
No, I got cut off.
Okay.
I was saying the challenge is that people are still not comfortable talking about mental health. And the other issue is that we need to train our managers and supervisors, because sometimes we're able to see that Angela is not the same Angela that we used to, but we don't know what to do to assist. And the person keeps coming to work, they keep on operating, but they have issues that they're dealing with, and they add up and they add up until they get to a point where a person becomes depressed or becomes mentally ill. And now we start dealing with the consequences of not having addressed the issues while they were at a very early stage. So we need to start having these conversations with our managers, even with peers, to say, when you see a colleague in distress, try to talk to them, because that's how we'll be able to start destigmatizing mental health if we normalize the conversations. Thank you.
Thank you very much. But maybe, Angela, before you go, there is a question here about what about those stresses in the workplace that are as a result of, I would say, conflicts within, the workplace between employees, or colleagues. How do you handle that as EHW?
Such cases, it's important that employee wellness personnel have close relationships with labor, for example, so that when a case like that comes in, sometimes the cases, if addressed early, is the same principle. If you address issues at an early stage, you're able to diffuse the tension. But sometimes, because we keep on going back and forth, they pile up and they pile up until they become huge. And you're not able to handle them because they would have been at a stage that they are very big. But if at a very early stage, we start mediating between the parties, you'll find that the issue could have been resolved easily before it becomes something that even makes it to labor. So the importance is, while issues are still at the start phase, let's deal with them.
Thank you very much. A question for Dr. Mahlangu, although it's not strictly within the topic, but I'm going to allow it. How many times is a member of GEMS allowed to go for the COVID-19 test, meaning a test that will be paid for by GEMS? So can you maybe share, Dr. Mahlangu, what is the approach or the protocol by your scheme with regards to people testing for COVID-19?
Okay, so because of the demographic of GEMS, which is your public service employees, and we know that majority of our public service employees are at risk due to repeated exposure of COVID-19. What we have said is that if anyone requires a COVID-19 test, they need to first be assessed by their medical practitioner for that test. And once they are then referred for that test, we do allow members to have a maximum of 3 tests. However, if anybody needs more than 3 tests of COVID-19, their doctor is very welcome to send in a motivation explaining why clinically this member will need more than 3 tests. So we're not saying a member must go out and test on Monday, Tuesday, and Wednesday because they have access to 3 tests. But what we're saying is that you are allowed to test on a Monday. If you're exposed in 5 days later or another month's time, you can test again. But all of this must be in consultation with your doctor who refers you. Thank you.
Thank you. Thank you very much, Doc. There is a question that came through my email. It's from Danny. It says, COVID is here to stay. We need to develop a strategy to deal with it and future possible strains, both the public service and private sector, as it impacts on the economy, and it can be devastating. Is there such a strategy in the process of development? Or if it is there in the process of development, how far is that strategy and who will be responsible to lead that process? I'm just going to throw it to either the DG or the DM. I think because the integrated employee health and wellness strategy was crafted by DPSA, and then shared as best practice with the departments. So I guess if there has to be a review, it also has to start at DPSA level. So DG, would you want to comment on that?
Oh, yes, I just want to say that I had indicated earlier on that we are doing a review of our own policies, and that we issue on an ongoing basis to departments. And certainly the review process takes into account the current context and the context of COVID. But I think beyond the context of COVID, the issue around how do we, from a disaster management point of view, from a business continuity point of view, how do we build our systems and our infrastructure so that we are able to respond to similar disasters? There is a business continuity, and there's lots of work we're doing as well, just around researching on remote work. We are currently finalizing a process of issuing a policy framework to our national and provincial departments in respect to remote work. The other issue relates really to continuity of services and business during the periods of pandemic. So COVID has given us a platform to learn a lot of things and to see how we can sharpen and invest more in terms of infrastructure and capability to be ready for similar situations that would happen in the past. So from a policy framework, lots of reviews that we are doing, but also this period requires us to invest, to think a lot about how we invest in our human resources, in our infrastructure, because if you have departments where people can't even operate basic capabilities, ICT technology capabilities, they may also struggle to deal. And if they don't have access to ICT capabilities, I mean, you know, in most departments, issues like laptops and phones are on the basis of ranks and etc. So those are the things that we're looking at to say, how do you enable consistently to allow a policy that allows for remote working, for people to be able to deliver on services wherever they are, and how do we ensure that as government we take more of our services into the ICT-enabled platforms to avoid long queues and etc. So it's a very big space of work that we're involved in currently, but there is reviews that are happening, and COVID has triggered a lot of things basically and a lot of responses. Thank you.
Thank you very much, DG. I think there's another question here. It's coming from Tandi, Dr. Tandi Matebula. Maybe because Dr. Tandi is actually on the panel, can she just unmute herself and ask the question herself? Dr. Tandi Matebula.
Good afternoon, Chairperson.
Good afternoon.
My question was based on the fact that EHW capacity is not sufficient, taking into consideration that COVID-19 is just an add-on on the strategy. So on the call phase within the departments, the coordinators themselves, they are experiencing burnout, they are experiencing stress because they cannot able to manage the workload that they are going through right now. That is my concern. I can see the strategy is there, But if the capacity is insufficient, who's supposed to implement all those pillars? Thank you, Chairperson. That was my concern. Thank you so much.
All right. Thank you, Doc. I think maybe even before we talk capacity, we all know that there's a phrase that who cares for the carers? You know, at a certain point, the carers themselves, they need to undergo some regular debriefing so that they can be able to fill up their own cups. And as part of the profession of, you know, of counselors, or even in the social workspace, there's supposed to be that kind of service. Maybe that's something that needs to be looked at, to say those people who are working within the EHW, do they get regular debrief? If not, what can be done so that they can be able to provide the support that they need to provide to the employees of those specific departments? All right. There is another question. All right, Dr. Alwalia has raised her hand. So you can come through, Dr. Alwalia.
Dr. Nyati, I just wanted to re-emphasize the point of employee wellness. Most of our staff, even in the Department of Higher Education and Training, which are in managerial staff, you know, you're talking about academia, or you're talking about support staff, admin staff. Now, I think there is a phase of burnout. The frontline staff are facing enormous stress and pressure during the COVID-19, and in general also. Work brings a lot of pressures along with it. What strategy for higher health has adopted across the Department of Higher Education Training, and might be some of use to other government departments, is building peer-to-peer networks, even an employee network system, not only applicable only to student community, as it works very well for the student community. We started with HIV as an epidemic, which brings a lot of stigma, and there were lots of employees who live with this pandemic. And the aim was to have adherence sites together, adherence employees together, who talk about it, engage each other, be each other's support, and continue. And starting with 3 employees or 2 employees in every campus level, we saw a numbers of staff coming together and starting engaging. The next movement was again gender-based violence, where survivors clubs started building up, and many staff who were survivors of sexual and gender-based violence came together. Nobody can take away the word called peer-to-peer influence. And I think mental health as a pandemic needs to also be looked in the same frame of stigma, in the same frame of a disease that affects all of us, but is very little spoken about. And if we can start building peer-to-peer networks in workspaces, confidence, resilience, abilities to handle starts coming up very well. Now, we've seen a change with other pandemics. We're introducing the same mechanism for mental health around the workspaces around this. And I just felt that we must talk about, engage on the peer-to-peer work. It's something which is very powerful and something which helps in coping people to live with something that is very little spoken about or has a huge stigma. Sorry, Dr. Nyati, I interrupted, but I just felt sharing something.
No, thank you very much. Thank you very much. I received another comment here from MHM Mabusela, clinical psychologist in the public sector. Unfortunately, she had some technical challenges to come in. Is there somebody amongst our participants who is a clinical psychologist who is dealing with challenges of supporting workers in the public service, so that they can maybe give us, because they're saying our panel is largely doctors, medical doctors, and there should have been a clinical psychologist. We did try, but at the 11th hour, that clinical psychologist was told that they don't have the authorization from the higher powers, and therefore they could not continue. Otherwise, it was part of our original plan. So is there anybody here, if they can just raise a hand, who's a clinical psychologist, and just give us a view from that? Adele Russ has raised a hand.
Good afternoon, Doctor and fellow panelists. I can maybe just come in here quickly and share with you that I am employed at a hospital. So my main focus area is actually for patient care. Currently, unfortunately, just how the setup is, I'm the only psychologist for the hospital. What I can share from our observations is a huge need among staff members for services. What has stood out for me is that occupational health, so services would be sought at occupational health, and when referred to the employee wellness programs, there seems to be a limitation or some kind of a resistance or not a follow through. So as a psychologist appointed by the hospital, ethically, I can't see staff currently because of ethical reasons and double roles. So my main focus is for patient care, but there is a huge need. So what I thought about and approached the hospital with is actually utilizing students to perhaps have small groups within, of course, COVID regulations, to perhaps have these type of debriefment sessions with staff, and perhaps think about developing a support program. So in community psychology, we are trained in developing programs, and I think this could perhaps be something to look into. So although I cannot work with the staff because of ethical reasons, perhaps this is another way to utilize students, perhaps to develop a program. So I don't know if this answers the question, but there is a huge need among staff.
Thank you very much, but I just want to ask you one more issue. Some of the frontline, nurses or even doctors or other members of the healthcare, delivery team, some are actually, getting infected. Others are even passing away. In your experience in your hospital, have you been able to be, of support to the team members who may have lost a team member to COVID?
I think this is a very good question, Victor. What I can just mention to you is this idea of peer-to-peer support is something I think is very valuable. So obviously as a clinical psychologist, I can offer peer support to my fellow colleagues I work with, but I cannot quite engage in a therapeutic relationship, as that is a different role, multiple role. But what has been really of such a support is just simply being a peer support system on a collegial basis. We have seen in our hospital, due to the nature of our hospital, we don't have, so there's been COVID cases identified, and then we transfer to the hospital appointed to deal with these cases. And of course, then we had a huge spike in staff infections. This had a rippling effect throughout the hospital in terms also of service delivery. As time went by, we're also seeing the impacts of staff members losing family members or close friends or colleagues. So there's this constant, from my point of view, observation of impacts and stress levels. So on a peer-to-peer basis, I can support staff. Being the only psychologist at the hospital, I'm also faced with a lot of pressure, dealing then of course with patients in the hospital. We're a long-term facility, so patients haven't been seeing families. They have not been allowed visitation or to go out. So it becomes tricky if you're also in the mental health industry, but really the only one to render the service.
Thank you very much. Prof. Zingela just wants to add, to this issue. So Prof. Zingela, please, you can be able to come through and share. We are going towards wrapping up. We're supposed to have this session ending at about 4:30. And before then, we need some closing remarks from the Honorable DP and also from the DG. So, but Prof. Zingela, you can come through.
Thank you, Dr. Nyati. I'm going to make it short, just to inform the attendees that where we are based as well, we are part of a multidisciplinary team that includes a number of clinical psychologists. And although we are primarily here to address the mental health needs of patients or people who need mental health services, what we've done is with the advent of COVID, we then started a program that is specifically targeted at supporting healthcare workers. And we have been able to deliver that program at 2 hospitals in Mthatha. We then expanded it to 2 hospitals in Port Elizabeth. And we do face-to-face, support specifically targeted towards fears and anxieties in dealing with COVID, also specifically targeted at healthcare workers if they have lost someone, whether it is, directly because of COVID or other issues. And what we found is we've trained quite a few hundred of them already. And what we found is that it has been a much appreciated program that has seemed to make a difference in their coping. And lastly, more recently, we've started going to the Department of Education space, where specifically in the Eastern Cape, we are busy with training of educational psychologists and other capable individuals like registered counselors on how to deliver support, first of all, for staff and learners within their environment, but also distance support. So there's quite a few things that we are doing to try and meet the needs where we are.
So with the experience of that program, Prof, is it possible, can it be reproducible in other parts of the country if, people, approach you from the Walter Sisulu University Faculty of Health Sciences?
There's no reason why it shouldn't be. And as I said, we started in the healthcare sector, and at the moment we've moved on to the Department of Education, specifically in the Eastern Cape. We are also looking at doing something similar for the Department of Social Development at their request. So as I said, if it's deliverable via distance, means from where we are in Mthatha to reach everybody in the Eastern Cape, there's no reason why it cannot be expanded even further.
All right. Thank you very much, Doc. I think looking at the time now, unfortunately, we're gonna have to stop questions. I just want to say there were some challenges with the capacity at the beginning. With the capacity of the webinar, something that is not, it's something that we still don't understand what happened there. However, the video of this session will be made available to DPSA so that those people who want access to this via the comms office of Mr. Mushi, they will be able to get this, this session, that's already been recorded, and be able to know what was discussed. Okay, now the time is 16 minutes past 4. I think at this point, I need to ask the DG for her closing remarks, and then after the DM, the Honorable DM will then close the session for us. Thank you.
Dr. Nyati, I just wanted to, there was a question on burnout.
Yes.
Because of COVID specifically, but I think generally there's an issue around understaffing. I just want to say that as far as it relates, firstly, the department is responsible to advise on departmental structures. So if there's potential and possible changes that departments want to propose, those would have to go through the processes for advice in the department, and departments know how those things are done. So if there's an issue there around how you build capacity, further capacity, it's an issue that we need to look at in that context. The second issue, just to avoid burnout, is that we just, during this COVID period, I think the issue is about reprioritizing resources in our response as well. So if there is a demand for health and wellness in a particular environment because of particular reasons, so it's important that the department on its own goes back and look at reprioritization of their resources so that they can be able to even bring in temporary additional support. It could either be through a service provider or through contract employments on a temporary basis to be able to close the gap that is there. As a parting shot for me, I just want to say thank you for this platform, and thank you for this opportunity. And I did my welcoming remarks earlier on, and I did indicate that we truly appreciate. We've listened to everything. We have a team here that's listening and recording, and we will take all the inputs into consideration with the processes that are unfolding internally. And there will be further engagements in terms of the work that we do with our colleagues in the public service, just for further inputs into our own policy processes. Thank you very much, Doc, and thank you very much to everyone who participated in this program. My sense is it's been very successful, judging by attendance and the reports, and the questions that colleagues are asking. And thank you to the panelists for giving us so much of their time to be able to be with us today. And of course, the Deputy Minister for herself for also sacrificing everything that she had to do so that she can be part of this conversation. I'm done, Chairperson. I am very humble in saying thank you to everybody. Thanks.
All right. Thank you, Madosini. Thank you very much. All right. Thank you very much. And so now, in terms of protocol, the DM has to be the last person who has to say anything, during this webinar. But can I just ask for a few minutes, just 1 minute closing remark from each of the three panelists? Just 1 minute from each of the three panelists.
If I may go first, Dr. Nyati, and this is basically to say from my side, this has been a very necessary, I would say, I'll call it an intervention. It's been a very necessary intervention in terms of making people aware out there what is available within the public sector space and what they can do to help themselves. And I'm hoping that this is not the last time we get to talk about these crucial matters. I especially want to thank the Deputy Minister for specifically highlighting the difficulty we face in providing mental health services currently, where they are forgotten and pushed as the last thing on the list anytime we look at resources. So I'm hoping this is a sign of a changing attitude in all government departments, not just in DPSA. Thank you.
Thank you, Professor. Doc Mahlangu, your closing 1 minute remark.
They're having counseling call sent. I would just like to say thank you for this opportunity and for inviting me here today. And this is a very important conversation that has needed to be held. And I stated in my presentation that one of the main challenges we have as GEMS, and I think as a society in general, is stigma. And amazingly, because there has been so much education and awareness built up around HIV and hypertension and diabetes and every other chronic condition, when GEMS looks at their stats, we see that the compliance where people are taking their medication regularly is far higher for all of those conditions, but not for mental health. We should not be seeing only 60 to 70% of people who have mental health conditions just taking their treatment and their medication? What more for people who seek out help very late? And I think that this is a conversation that we all need to have, and we all need to work together as all spheres of department and private and as stakeholders in this very important conversation that we're holding today. Thank you.
All right, Doc, just before you disappear, Doc, just an issue around benefits allocation, generally by medical schemes. They tend to have very thin benefit allocation when it comes to issues of mental health. You know, whether we're talking for, you know, the benefits for people to go and consult psychologists, you know, and all of that. So with, you know, people are talking about a parallel pandemic to COVID-19, that is the mental, you know, health impact, which is going to be with us for a long time, you know, even after this pandemic has passed. So are there any plans to relook benefits for mental health? Like I said, they tend to be very thin.
Okay, so when we look at mental health benefits, unfortunately in South Africa, it's a historic conversation, and our healthcare system has always been what we call hospice-centric. It's always around admission of the patients, you know, and not necessarily looking at managing patients out of hospital. That's just in general, not just with mental health. But with mental health, what happened is that when your prescribed minimum benefits were created by the Council of Medical Schemes, way back over 20 years ago, they said that what medical aids are required to pay for is 15 outpatient visits, and that must be split amongst psychologists and doctors, or 21 inpatient days when you're admitted. And that's why we monitor our 30-day readmissions and our multiple readmissions. And as GEMS, that's why I said, lastly, in terms of benefits, is for people to apply for ex gratia, because we know that the benefits are thin. We know historically that benefits are thin, and our current benefits might not cover enough. And we always, as people, apply for ex gratia. We'd rather have you apply for ex gratia and asking for extra money to pay for your medication than for you to be readmitted in hospital, when that could be avoided altogether, and you have better health outcomes as a patient. Let's not even talk about costs, comparing your medication and your admission, but you as a person, you do not need to be constantly readmitted because you do not have access to healthcare. And unfortunately, that is a historic thing with mental health. As the Deputy Minister did say, that it's on the back burner, it's one of the last things. But what I can say that is the CMS also embarked on re-looking, beefing up and updating your PMB, your prescribed minimum benefits. And that was a project that was done last year through CMS and as the industry as whole. And a lot of the mental health conditions were also looked at. So hopefully going forward, post-COVID, during COVID, we'll start seeing better access to healthcare in terms of your medical aids.
Okay, thank you very much, Doc. Thank you very much. Dr. Alwalia, your 1 minute rep.
No, thank you, Program Director, Dr. Nyati. I will agree with the Deputy Minister's view around speaking to the principle of the national NGC around, I'm forgetting the terminology, but capacitating the managers in public service around the issues of mental health to sensitize them. I think it's a great initiative. It's very, very importantly needed. I will further request DPS to reconsider or consider ensuring that these issues of helplines, of 24-hour helplines, available in easy access to public servants for in supporting them on stress, anxiety, not only during COVID-19, but in general, when it comes to issues of mental health, looking at very cost-effective mechanisms of peer-to-peer development of influence post the training of managers, and just highlighting mental health as one of the most important enablers during job descriptions or KPIs in the management sphere, so that mental health gets its predominance. It also helps in getting more returns back from our employees, so that our productivity as government, our productivity as public servants has grown further, and we have less absenteeism. We have more, we look into the more economic sense of why mental health will also look at long-term effects towards giving us dividends back if invested now and properly during our public service environment. So with that note, I'm grateful for allowing me to speak. Thank you, Program Director.
Thank you, Doc. I think, I know there were two hands that were raised, but I think the time now has come for us to give the DM an opportunity to wrap this webinar because she's got other commitments that she has to go to after this webinar. DM?
Yes, Dr. Nyati, thank you very much for the opportunity. And I can agree with the previous speakers who actually said this is a necessary discussion and engagement. And I think it's not the end of it. We need more on this topic. I just really want to thank the participants, our panelists, who are experts in their fields, and they've proven beyond doubt that they know their story and they know their field. They make us proud as South Africans to know that we have such people in the country who can rise to the occasion and share information with us without any fear of contradiction. And I just want to thank them for that. Chair, there was a question on conflict management. And in my heart, something was actually saying, any senior manager that we interview, one of the questions will be to say, are you able to manage conflict? And they go to town talking about that. And I think it's important that it doesn't end in interviews, but it gets implemented. But maybe just to mention, Chair, that in the public service, we do also have, over and above the employees' health and wellness units, but we also have labor relations units. And the aim of their existence is to assist in dealing with conflict in the public service. But that also might not be enough. Senior managers, including DGs of departments, they assist with that responsibility of dealing with conflicts in departments. On the issue just on policy on COVID, COVID is indeed a medical condition. We will rely mainly on the Department of Health leading on information that will require the scientific data that needs to be there. From time to time, things will change. If somebody was to say today we have a vaccine of COVID, the whole narrative will change because it will be to say how long does it take for the body to form antibodies and so on, and therefore all that jargon that will come with that if and when we get a vaccine for this one. So the information, of course, will rely on the Department of Health leading us on this one. And as the DG was saying, on the basis of that, on the information, then we say, this is what you're going to do. You can work from home, remote working, and so on and so forth. But we are guided by the scientific data that we get from the Department of Health. I just want to mention that as I summarize, I think it is important for the department to therefore, after this, assess the strength, the capacity and capability, and the debriefing mechanisms of employee health and wellness officials in all departments in the public service, so as to see as to whether the amount of work that is now available to them does not need the extension or the added numbers of officials in those units. Secondly, I think also from what we have said today, is the fact that we do have the National School of Government. And I think we can actually influence their curriculum depending on the needs. And for now, with the COVID-19, with the figures that we have from GEMS and other medical aid schemes that we have, it becomes obvious that we do need something that covers mental health education and training programs. And I think we have to approach them so that they can include this in their curriculum as quickly as possible. We anticipate that the mental health problems might increase with this pandemic, which is COVID-19. But also, I think we have to ensure, as we've indicated, that we have effective, sound labor relations programs that are responsive to workplace challenges relating to managing conflict in the workplace. Also, I think we have to allocate workload into manageable portions according to capacity assessment per employee, and to include the principles of delegation, so that you don't delegate something that I'm not capable of doing, because that can actually frustrate any employee. It is critical for the public service also to continue with the mental health programs beyond the mental health month, as I indicated. With the information that was shared with us here and the services that our panelists said they offer, I think this has to continue, because we are all in agreement that awareness and education, health education and mental health conditions has to continue. It can't happen only in July, and I think we've got to do that. With the prevalence of mental health problems in the public service, I think it calls on all of us to do something about it, to destigmatize it, and to make people aware that it is a condition that can affect anyone. It is an illness that can affect anyone. And it doesn't mean that if you have, or you are said to have a mental illness, it means that you are crazy, or it means that you have asked for it. It's something that can happen to anybody in the country. I once more, program director, want to thank you as well for initiating this program. I want to thank the DG for initiating this program. I want to thank our participants for preparing and taking their time. You know, it's 3 hours now, them sitting here, listening, commenting, answering questions, assisting all of us, teaching all of us, and we don't take that for granted. We really want to thank them again, and to thank you, Program Director. And I say, God bless you all. Thank you.
Thank you very much, DM. Like I had said, because of protocol, you should be the last person who says something. So all that is left for me is to thank everybody who participated, from the panelists to all the other attendees, the questions that came through various platforms. I think the challenge has been put to all of us who organized this to say it can't just be a July thing. But then, you know, there will be a debrief, and hopefully we will then come up with a way of addressing these issues going forward. So I want to thank everybody for cooperating with me as I was trying to drive this process. And may you all, you know, stay healthy, COVID-free. But even if you do get COVID, know that it is not a death sentence. For 98% of South Africans who do get COVID, they recover, you know, fully. And so let's not think that by getting COVID, it's equivalent to death. So with those words, thank you to everybody.